Erik with you from A to Z PT.com. Thanks for watching. Wanted to talk to you about medial tibial stress syndrome, or more commonly referred to shin splints. A lot of runners experience this. It's pain, excuse the diagram here, but if you can imagine for a moment that these are your legs here. This is your hips and your pelvis. You have your big femur bone, you have your knee, you have your lower leg, your tibia and fibula here, ankle and foot. And what happens with shin splints is a lot of times we'll experience pain in the inside part, the medial posterior part of our leg, right in this area. And it can be very, very painful. Many people have to stop, if not decrease, their activity level due to the pain. It can be chronic. It can lead to other areas of pain also, affecting the whole segment here. So let's break this down and see if we can kind of put our finger on what could be a culprit, what could be causing this sort of pain, the shin splint. So I want to start at the top. A lot of times when we do have a deficit of pain or weakness or restriction, we have to look other places just than where we're feeling it, because a lot of times that's where the answer will lie. So let's check this out. Up in this region, again, excuse the picture, but up in this region, in our hip, in our rear end, back in here, we have a series of muscle called our glutes, or our gluteal tissue, comprised of the gluteus maximus, the medius, and the minimus. And we're going to concentrate on the gluteus medius here. And let's see what this muscle does. This muscle, which again attaches from our hip, our backside, down to the upper portion of our femur, it controls that leg, and it maintains stability here, so the leg does not move too far forward. It does not, we call that adduction. It does not draw that leg in. When there is a weakness, when there's a restriction, a deficit there, that is exactly what happens. We have a give here almost. It breaks down, so this femur bone starts to move inward. And when that moves inward, what happens down below is all affected too. It's a chain reaction. It's one unit, but if there's a deficit, if there's a weak point in that link, the whole unit will be affected. So again, there's a weakness at the gluteus medius, which unfortunately a lot of people have. And when that weakness occurs, the femur bone is going to move inward again. It's not going to be stable. It's going to buckle in. When that happens, it's going to rotate the knee and the two bones below in the lower leg inwardly also. So we have this breakdown up top, and then we're going to have this inward rotation, this buckling sequence almost. And let's keep following this further down the trail, further down the chain. What's going to be happening now is if this leg is internally rotating, it's going to affect the ankle and also the foot. That same sequence is going to have that effect where the ankle is going to start to bow in and the foot is going to follow. And we call that overpronation. Let me grab a prop here. An old stinky shoe. But so when we make contact with the ground, when we make contact, initial contact, our foot does tend to roll in, and we want that. That frees up more motion. It's part of another chain reaction which lets us propel forward. But what happens is when we have that weakness up top from the hip, stemming all the way down the leg and affecting the bottom portion of the foot, when we start to roll in, when we make contact, we start to roll in excessively. We overpronate. Remember, Pronation is good up to a point, but if it's excessive and we overly pronate, meaning the foot is going to turn in more, that is going to cause a lot of stress, too much stress to the tissue that tries to support that movement. And that's where we get shin splints from. That is one of the major culprits. Now, there can be some other factors. A lot of people will have restrictions in their calf muscles, even in the knee can cause some of that to stem down further down the chain. But the major cause, if I had to tell you to look in one place first, it would be boom, right up here with those muscles, those gluteal muscles, more specifically the gluteus medius muscle. Weakness deficit causes that femur bone to not be stable, starts to move inward too much excessively. Then the knee and the bones below in the lower leg start to internally rotate. Internally rotate causes the foot to overpronate. And there's again where we have those tissues, those muscles, those tendons trying to support us within a movement that is too excessive and done repetitively, like a lot of runners are doing consistently. It's going to cause breakdown in this area, and it's going to cause the pain, and that's where you get your shin splints from. So, of course, what we want to do is first be able to diagnose this, and a very simple way you can do this is just by looking at your hips. If you can videotape yourself or have a friend videotape you when you're running or jogging, and you notice when you put your weight down on one leg, your hips are dropping the other way. So here's, say this is your hips, this marker. When you put your weight down, on this side, if your hips are dropping the opposite direction, that is a pretty clear-cut sign that you do have weakness in this gluteus medius muscle. That's causing the hips to drop on the opposite side, and then you get this chain reaction, rotation, internal rotation, overpronation, shin splints. So again, an easy way, just have someone film you running, and if you see that drop in the opposite hip, then again, that is a red flag. That is a strong indicator that you do have weakness in this area. On the positive side, on the good side, there's always a good side, but first we have to diagnose it, and we have to diagnose it correctly. A lot of times people will try buying more expensive shoes to get extra support, and that may help, but I would say it's more negligible type of assistance because you're not correcting the problem. People will wear compression around their lower leg, their shin, trying to compress, and that will help deviate some of the forces. But again, it's just that Band-Aid type of approach where you're not really targeting what is causing the problem. So we want to diagnose this correctly first, have someone videotape you. If you are dropping that opposite hip, then again, we know it's stemming from that glute medius. And again, positive, we can definitely do a lot of different exercise, stabilization exercises to get this glute medius to kick in, to fire like it should, stabilize this segment so you're not getting that overpronation. If you are having shin splints, I'd be happy to help you. I'll leave my email down below. You can shoot me an email. You can even send me a video of yourself running so I can see it, or you can just tell me your symptoms, and I should be able to get a pretty good read on it and can send you some further information about how to start targeting that glute med, how to stabilize it and make this segment functional again so we're stable throughout the impact, the high impact of running. So I hope that helps you. Again, I'll leave my email if you want some extra help. And as always, thanks for watching, and now make it happen. Take care.